Hi everyone, I'm Jaya Vishwanathan, and you've found the No Brainer podcast where I discuss all things neuroscience in delightful conversations with various experts. I hope you enjoy today's episode. Hello everyone, I'm so excited to invite you into the season 2 of the No Brainer podcast, and I have a very, very special guest here today, and I can't wait to share this episode with all of you, and I'm so delighted to introduce Dr. Natalia Chechko, who has kindly agreed to share her time and expertise here with us. Dr. Natalia Chechko is a tenured W2 professor of experimental neuropsychiatry at the RWTH University Hospital Aachen. Her expertise is in neuropsychobiology, specifically in the changes that happen in maternal brains through menstruation, pregnancy, and postpartum. She has published extensively on this historically understudied topic, and her research has expanded our understanding greatly on the risk factors leading up to postpartum depression and the structural and functional brain alterations during these processes. She additionally has expertise in olfactory and chemosensory mechanisms of social communication. So as you can already hear, we have a ton of topics that we're going to discuss today, and I really hope that you enjoy this as much as I've enjoyed talking to Dr. Chechko already. Dr. Chechko received a degree in journalism from Lomonosov University in Moscow, Russia, followed by a graduate degree in human medicine from Johannes Gutenberg University in Mainz, Germany. She has since served as a professor, research team leader, and senior physician. She's also supervised several students in their careers. So, Dr. Chechko, I'm so excited to have you here, as I said. And so you are an expert studying changes in the maternal brain health through pregnancy and postpartum, and there are very few research studies in this critical area. So thank you, first of all, for doing such important and critical work. So can you tell us a little bit about your journey and what you enjoy about your work?
Thank you so much for this kindly introduction and for possibility to talk to you and to you guys. So this research didn't start like from the it was not sure in the beginning, or it was not my plan to work in this area. It started gradually before I started work in the area of female mental health. I worked as a psychiatrist and worked a lot in the neuroscience generally. And it's kind of the focus changed when I got pregnant with my first child, indeed. And then I was going to a gynecologist for all kinds of checkups, and one of the gynecologists, a professor for obstetrics in Aachen, told me that he sees frequently women being affected by depression postpartum, and he thinks that psychiatrists do not take it too seriously, or that missing knowledge among psychiatrists about as well. So that's how I started indeed working on this topic. And what we did first, we started recruiting one of the biggest longitudinal cohort studies when we included healthy mother after them giving a birth to a child and looking how their mood, stress, and attachment to the child changes. So first the focus was mainly what do we need in order to predict depression, but gradually we moved from this clinical perspective more to neuroscience perspective. We started having first papers, or it was first papers available from Barcelona, for instance, as well, that brain is different after pregnancy, and we decided to check, see how is it in our cohort, and indeed we saw these differences, and it was the surprising, and that was the beginning of our further work related to this adaptational processes associated with postpartum.
Oh, cool. So this is fascinating so that it's so personal as well. So I imagine that, things like getting funding for this can be really difficult as well. But tell us some of the research and clinical questions that you're working on right now with this
rich cohort and a little bit more about the cohort itself. So
Mm-hmm.
I understand it's a very big cohort.
Yeah, it's like cohort which is finalized now. We're not recruiting in this cohort
Okay.
anymore. So we recruited about 1,000 new mothers.
Wow.
So after them giving a birth to a child, like around 2-3 days after them giving a birth to a child, and we followed this woman for first 12 weeks, and then we saw that we want to actually see what happens after that. So they have further time points at 6 months and 12 months postpartum.
Mm.
So, and that we have recently a perspective in natural mental health when we include that as well, in which we actually discuss that the major mood fluctuations happens within the first 6 postpartum weeks. And so it is really that's diagnostic criteria for postpartum depression as well, that the first weeks postpartum are associated with increased risk for affective disorder. And it has to do with a lot of factors. We took a look at those factors, and it has to do with this hormonal fluctuation as well. So you have an extremely high level of hormones in pregnancy, and it drops off after the birth of a child, and women like expecting this withdrawal of hormones for a while, so which can contribute to this changes in mood. But a lot of other factors are coming as well, right? I mean, it's very emotional time, and it's a stressful life as well. So giving a birth to a child, it's basically a stressful life event, and sometimes it goes, the women expected this to happen, sometimes it's not. It's a changes of roles, of perspective. So we kind of created a model which included all kinds of risk factors to see what would be the combination, which risk factors contribute the most for development of depression. And we can see that so-called sensitivity to hormonal changes, as for instance, a woman generally before pregnancy had more emotional mood swings during the period, the cycle, menstrual cycle. So it is actually a predictor for later postpartum depression. If women immediately after the birth feel unwell and cry a lot, if they develop so-called baby blues, it's a predictor as well. And for sure, that the birth was like stressful, they didn't get enough support, and previous psychiatric problems, all of that is what contributes to developing of depression. But for sure, the most people do not develop it. It's about 9% of women develop depression, but a lot of biological changes happen none the way. So it's like all women go through this biological adaptation. In the most of cases, it's like fine, if nothing happens, they don't develop a depression. But in certain group of women, it can be a trigger for depression or anxiety.
Oh, that's so interesting. And already I have a couple of questions. So one of them is you've mentioned a couple of different things like baby blues and postpartum depression, and they're different. And you and yeah, so can you talk a little bit about like the different almost categories of things that can result from that baby blues and yeah.
Yeah, so that was a topic of this publication as well,
Okay.
on Nature Mental Health. What
Okay.
we could see indeed that about 50% of women are emotionally, they have certain type of emotional lability after giving a birth to a child, right? So-called baby blues, it's actually quite frequent phenomenon. So, and people like kind of even say it's normal that women are emotional after giving a birth to a child. For sure, right? I
Yeah.
mean,
Yeah.
it's a major life event, and sometimes women cry more during this period of time, but usually women leave this phase very quickly. So that's like the baby blues, they usually last maybe 2, 3, maximum 5 days. But if they're like really prolonged, if they're severe, if like after 2 weeks women are after giving a birth, women are still crying, then it's an indicator that the baby blues actually are predictor, or like baby blues continued, and after a certain time of point, you have this, after 2 weeks of depressed mood, you can say it's actually a depressive episode, right? So the most of the women like 50% have some liability, yeah, in the
Yeah.
first days. But for the most of them, it's like last only a couple of days. And if people remain longer in this period of time, if it's like now
Yeah.
3-4 weeks, they still cry, they're unhappy, they cannot develop bonding to the child, this is a sign of postpartum depression. And this is about 8% of all postpartum women.
Wow. So is there something that either pregnant women or their partners can do to kind of prevent that baby blues to go into depression?
Well, yeah, well, this prevent is always like to take care. I think that's
Mm,
what happens. I see these women in a hospital as well because
yeah.
I mean I treat them as well. So what frequently happen that women stay in this phase alone at home, so they don't get enough support. So, instance, I know that all the culture, all the traditions, they're usually like the all members of family would come and support and like celebrate the birth of a child. And I experienced really that women are left alone. So that's like there's some separation in generations. It's like not like in older times, all aunts and grandparents will come and try to do their best. So women are basically really alone. I think they're very stressed out. I think the time,
Yeah.
if family takes care of them, if they have less stress, is very useful. Sometimes women are dealing with the circumstances of the birth as well. So they're like kind of traumatized by that as well. So because of the pain or because having a feeling of losing control over the birth of their own body or like, I don't know, changes of roles. And it's good to talk about that. So in the
Yeah.
psychotherapy, I see that a lot of women overcome this period of time, even postpartum depression, when they have opportunity just to resolve that issues for themselves.
Okay, that is a really great tip. Thank you so much for sharing that. So I think you talked a little bit about some of the motivations that led you to this research topic, but overall through your career, I noticed that you started with a journalism major. So
Yeah.
can you talk about how like you went from journalism to treating pregnant women in the clinic? That's pretty great. Or postpartum women in the clinic.
Well, it didn't happen like overnight, right? It was a long
Sure.
process. So, I think I was very young when I finished my school. I was only 17. It was like typical um,
Okay.
in Russia by the times, and I think I didn't know yet exactly what I would like to do.
Mm-hmm.
I thought it would be cool just to write, to inform people, to give them information about what happens in the world. Plus, I thought that via this journalism study, I could travel, see the world. And when I was studying in Moscow, I started already working, and I started working indeed as a medical journalist. So I worked with areas associated with medicine, with surgery, with new discoveries. And when I was doing all of that, I kind of always was missing that I'm not a doctor myself. So
Mm,
I just decided it would be great. Or I kind of like felt that I would like not only to write about that, but to do it myself. And that was my major motivation to start medical studies. And I
Mm-hmm.
had the opportunities to go to Germany to do that. And when I was studying medicine, I kept writing all the time. So writing was always like very important for me. And during studying medicine, I actually realized that you can do it the best being neuroscientist or psychiatrist, and there's so
Yeah.
many different exciting topics. So I thought it's always somehow more exciting to write about neuroscience than to surgery. Please don't understand me incorrectly.
Yeah.
So that's how I moved and become a psychiatrist. So I thought I can combine those two things, which I like to do. So to talk, to research, and to write.
Yeah, and I mean, I'm guessing you're like trilingual at least, so you speak Russian, German, and English. So clearly there's a lot of influence there in the love of languages too, no?
Yeah, so
Yeah.
that's actually thanks to my studies in Moscow as well.
Okay. Very cool. So I'm curious about your approach towards asking these research questions where there are just so many individual differences. And I think you alluded to that when you were talking about how for some women it can be more stressful because it's unplanned or they have less support from family. And so, can you talk more about how you design studies and how you approach data analysis? And you mentioned building models for risk factors. So how do you conduct basically these complex studies and then more importantly, how do you draw conclusions from them?
So it's about as well which type of studies we're talking about that. If it's like longitudinal studies, when you see this changes in mood, right? Then it's like one part of the studies which we do, but we do neuroimaging studies as well, right? We actually
Okay.
study the brain. So in terms of building predictors for postpartum depression, we use machine learning approaches when we look
Okay.
at all kinds of factors and we see which combination of factors can predict development of depression the best during the timeline. From this cohort, which we built about in regard to postpartum depression, the idea was actually first how maybe even brain changes or something in the brain can predict development of postpartum depression.
Okay.
And so in the first cohort, we included MRI measurements as well shortly after woman giving a birth. So we included changes of structural brain or like functional connectivity in the brain. And we thought that that would give us any conclusions about depression. But indeed, during our first trials, we didn't find much difference at all. We didn't find any predictors in the brain. So we could predict it based on the changes in behavior, like for instance, this drop of hormones associated with changes in mood, but not in the brain. But like what we did then, it was like a first studies which was suggesting that the brain after a woman giving a birth looked very differently. So I didn't believe in that. I thought it cannot be true. And I decided to check it myself. So we compared postpartum women after them giving birth of a child, like really several days after childbirth, and compared them with women who were never pregnant before. And we actually see that immediately after birth of a child, huge difference between these two groups.
Okay.
So we have one of our first publication about that was done 2021 in cerebral cortex, when we indeed compared nulliparas with women, with young mothers, and we saw that such areas like hippocampus, amygdala, prefrontal cortex, they have smaller volume. So there actually, indeed, there was like some networks which looked differently in postpartum women. That was the beginning of this research on brain, because I asked myself, like, does it stay like that? Like, is it like, do I have now less brain? So will something change to that? And based on that, we developed a set of new studies when we look longer at the brain changes. So we measured women not only after them giving a birth to the child, but every third week. So we had several measurements, and based on that, we got a number of publications. For instance, Translation Psychiatry last year. So when we actually saw that these changes are gradually diminishing, so the difference is getting less and less, and we saw as well that in particular the first 6 weeks are associated with huge changes, so they're really crucial. But we still could see that some differences remain, particularly in emotional processing networks, and we could see that it correlates as well with development of bonding to the child. There's some association. So basically, it has this physiological reason, but it must have something to do with adaptation to a new role, to be a mother as well. So there's some learning process which contribute to this changing in the brain. So if you like come back to your question, how we designed the studies, we designed it frequently based on our result itself, right? So you have maybe the first study, you see some changes, and then you think, what is the next question? So how should you design the next study to explore what happens in the brain? So we started first with these thoughts, how we can predict postpartum depression. we see that the best predictors is still behavioral changes. Then we compared the brain of postpartum women with nulliparous women, and then we did longitudinal study on postpartum women as well. And we looked what is the contributors, what is the factor which influence brain structure and brain connectivity.
Yeah.
So it's time first. So time plays a huge role. So the major changes you can see closer to the birth, but like gradual development of binding to the child, that's contribute to these changes as well.
That's really interesting to me. I'm always interested in like what are the evolutionary drivers for something. And so I think you've talked about that a little bit. So obviously some of the maternal brain changes are as a consequence of just needing to bond with the child and things like that. But are some of them also just side effects almost of the pregnancy process itself? And I have a second question there, which is, so you looked at newly birthed mothers or mothers who've just given birth with never pregnant, and you followed them longitudinally. So what I'm thinking of is that change that you see right after birth, is that reversible? Are some of those going to get reset to baseline, so to speak, while others might not? Like the emotional bonding might never go back to pre-baseline status, but are some of them more impermanent and transient?
Yeah. So right, you have like some more like transient effects. For instance, in the first 3 weeks, it looks like the brain is less everywhere. So it's like the huge changes. It must have something to do as well, I think, with the liquid distribution in the brain.
Okay.
And the idea is as well that in pregnancy, women have a much higher level of hormones, and this very high exposure to hormones leads to this structural changes. And basically, in the first 6 weeks, a lot of these changes go away. But what we can see that even still 6 weeks postpartum, new mothers have smaller amygdala, small hippocampus. So basically areas related to stress, related to memory and emotional processing. And we do not yet, is it like indeed maybe time point when those changes go completely away, or like the mother's brain is primed? So it could be both. There's some studies done by other researchers which suggest that they can see differences even 2 years postpartum. But maybe it might have something to do with the fact or with the time that those changes may be still seen as long as the woman takes care of her younger children, right?
Yeah.
So maybe when you're like out of this phase when you take care of smaller children, then it would be happening a reset. Because I think for nature it's very important that the woman thinks and functions differently as long as she has a small child.
Yeah.
Right?
Yeah. No, that makes complete sense. No, that's super, super interesting. And yeah, like I said, so many questions about your work and your research. So this is very cool. So the other question I have is I notice you've been looking at both hormones and brain connectivity. And, looking at both simultaneously, like what kind of insights are you getting from looking at both, and how does that inform each other?
Okay. So what we did as well, we actually not only looking at the peripheral hormones, not like what we can measure in blood.
Yeah.
Because I mean, what you measure in blood, it doesn't mean that you have the same in the brain, right? So there maybe not this correlation. But what we did as well, and we submitted recently a new publication, and hope we will hear something good back. We looked what is the receptor distribution of areas which are like getting via adjustment during postpartum period of time. And we saw that indeed areas which are getting like restructured during this time, they have a higher number of progesterone and estrogen receptors. So it has something to do with sex hormones indeed. So areas which are going through this restructuring, they have higher concentration physiologically, like in humans, of sex hormones and stress hormones as well. So it must have something to do still with this high exposition of hormones during pregnancy. Yeah.
That's very interesting. So you mentioned the sex hormones, that makes sense. There's changes, all these changes that happens with pregnancy. What kind of effect do stress hormones have on pregnancy?
So, in pregnancy, you have physiologically much higher level of stress hormones as well, because
Okay.
placenta contributes to that. So, and stress hormones actually, especially to the end of pregnancy, are important because it helps a child like to be prepared for the birth. Yeah, it's actually important that the child is like a little bit stressed out to get to be fit as well, to be prepared for this stressful life outside.
Okay.
So, but for instance, depression as well associated with a higher level of stress hormones as well, right? So it can have, you have both, you have this physiological contribution, you have a normal distribution of stress hormones, but generally high exposure to stress in pregnancy. After that, that's associated with depression as well.
I see.
Hey everyone, hope you enjoyed this episode of the No Brainer podcast and see you at the next one.